The video you're about to watch depicts real events. The people you'll see are actors, but they're portraying students as they go through their interprofessional simulation exercise in our CAPE Center. This is an exercise that you'll go through as well as you progress through your interprofessional education experience. We ask that you think about the fact that these are your fellow students as you watch this. Be professional in how you view it, be professional in how you speak about it, and think about the fact that these are your colleagues and your goal is to help them improve their performance.
All right, welcome. So we're here at our brief. This is just going to help set us up for the scenario. And I want to remind you that it's a great opportunity to practice your communication skills and integrate it with your patient care, your clinical care. Okay. So we're going to start off, if you don't mind just reading the case.
Oh, sure. Oh, sorry. 55-year-old Jordan Evans tripped over her dog yesterday and landed on her shoulder. She did not think it needed to be checked right away. This morning the pain in the shoulder has gotten worse and interfering with her physical activities. Her partner decided to bring her in today because she is in a lot of pain and has limited range of motion. Vital signs were taken upon arrival. No additional information or history were gathered.
Okay. So where would you start?
X-ray. I'd want to do an X-ray, make sure there's no fractures since that's still in pain. Or she's still in pain.
Yeah, and then maybe like a physical therapy consult, something like that.
That's good.
Pain management in terms of medications. And
Yeah, probably get med history and drug, any allergies.
allergies, yeah.
Yeah, that's a good idea.
Great. So what communication tools would you use with that?
I'd really like to try call out and check back.
And I think we should definitely do a huddle.
We should do a step and a huddle
Yeah.
then as well.
Yeah.
I think the introduction is really important. Patient verification, also using each other's names and introducing ourselves with our roles.
Yeah, it's a good
Yeah.
idea.
Clarity is
Yeah.
good.
That's
Definitely.
great. So what about your clinical responsibilities?
I'll do a history and physical.
Okay.
So, yeah.
I'm comfortable with doing vitals and maybe pulling meds.
Sure.
I'll just sort of back up Deborah.
Okay.
I'll ask about medication history, also any allergies as well.
Great.
Yes.
Good. What about team roles? They're a little bit different.
I'm interested. I know there's a partner. I've never been interacted with family members, so I think I'd like to be the point man to work with a family member. That's possible.
And I can be on the phone. I can call for external consults, things like that.
I guess I'll scribe.
I'll be the leader then.
All right. So who's going to monitor the situation and call a huddle if it's needed?
Can anybody?
Yeah.
Anybody can, right?
Yeah.
Sure.
Yeah.
Yeah, I think we definitely need to do a lot of cross-monitoring, and
Yes.
Yeah.
if something,
That's a good idea.
if we get in trouble.
No, I can call a huddle just even if we're doing really well, so we can make sure we're on the same page.
That's a
and
good idea.
and Stuff like that.
That's
Right.
great. What about if you need a handoff? Is there a tool that you would use for a handoff?
S-bar.
That's the answer.
Right.
Yeah.
Does anybody want to be responsible for that, or
I don't know,
do
Sarah,
you think you
wanna
need
do
to
that?
assign that?
Yeah, I can do that. I mean, I can read off the
Yeah.
board.
Sure.
But yeah,
We
sure.
can all contribute.
Sure. Great. What about a contingency plan if things aren't working like you expect it to?
I think that goes back to that kind of that situational awareness, like we were talking about,
Yeah.
cross-monitoring.
Right. The situational leader, we can change up, roles and stuff like that.
Asking for help and being available for help. Be available,
Yeah.
Yeah.
Great.
helping with the phone or whatever.
Yeah.
Vitals.
And I can help with whatever anybody needs.
What if there's a conflict? Do you guys remember the tool we used if there's conflict?
Cuss.
Yeah.
Yeah.
You remember what that stands for?
There's
Concerned,
Uncomfortable
and
safety
safety
issue.
Great. You guys feel ready?
Yeah.
Let's do it.
All right, let's go.
Okay.
Yeah.
Jordan?
Yeah.
Hi.
Hi.
I'm just going to wash my hands really quick.
Okay.
Um,
Wow, there's a lot of you in here.
Yes, there is. So my name is Sarah. I'm a medical student. I'm going to do a physical with you today and take some of your history.
Okay.
Okay, and let me
Sure.
just introduce your team for you. This is one of our nurses.
Hi, I'm Deborah. I'm going to go ahead and take your vitals.
Hey, hi.
Hi, I'm Drew. I'm the pharmacy student.
Hi.
Hi.
Hi, I'm Susan. I'm one of the nurses, and I'm just going to be taking some notes for us today.
Okay.
And Drew, can you go ahead and call for a shoulder x-ray?
Shoulder
We don't
x-ray.
have that on the chart.
Sure thing.
Hey, do you guys mind if my wife comes into the room? I just like her in here. but-
Yeah, sure. Is she in the waiting room?
Yeah.
It's going to get a little snug.
Okay, thanks. Her name is Michelle.
I'm a radiology,
Michelle,
please.
okay.
Thank you.
So yeah, Deborah, do you want to call
Hi,
waiting room
this
for
is Drew,
Michelle?
pharmacy
Sure,
student, calling
Michelle,
from room
you bet.
A,
I will call
patient
for her. I'm
Jordan.
going to
Thank you
go
so
ahead and
much.
put this on your
And
finger first.
we need a
And so
left
Jordan,
shoulder
I have
x-ray.
in your chart here that you're here for some left shoulder pain from a fall you had a couple
Yes.
days ago.
Yeah, it was
Thanks very
so
much.
stupid.
Will
I
you
tripped
take over
over my
vitals?
dog and I landed really hard on my left shoulder.
Okay. So we're going to do a little bit of a physical.
Shoulder x-ray called for. They'll be here shortly.
Perfect, thanks. And then we want to rule out there's no break or anything like that in the shoulder as
Okay.
well.
Hi,
Susan,
this
I'll
is
continue
Deborah.
with the
And
vitals,
before
okay?
we go into
Sure,
the
that sounds
shoulder,
great.
though,
I'm
can
your
I
patient,
just get a little bit more
And we are
previous
looking
medical
for her
history?
wife,
Yeah.
Michelle. I think she's out
So
in the waiting
anything in the
room.
past of
So
note
if you could
that you
page her?
had, like
Yes,
anything
she
in your
would
health
like her in the
history?
room.
So I'm going to
Well-
put these leads on your chest. Jordan,
Thank you very
okay?
much. I appreciate
Um,
that. All right.
Yeah, I mean, I
Bye-bye.
have a history of angina. I was in the hospital a couple of times for that.
Okay.
Jordan, Michelle should be in any minute.
Oh, great, thank you.
So a previous history of angina, and you said you were in the hospital for that.
Thank you, Yeah. Drew.
How long ago was that?
Oh gosh, probably like 3 years and maybe 5 years ago now.
Okay. And anything else that you've been
Hi.
hospitalized
Hi.
for?
I'm
Any like
Drew. I'm the student
surgeries or anything like
pharmacist.
that?
No,
Hi,
no.
Michelle.
Michelle,
Hey, honey.
Hi,
Deborah and
Susan.
Sarah.
Thank you for coming.
Hi. Everything all right?
Yeah, we're
Jordan,
just
you okay?
Yeah.
Susan,
Yeah,
I have some vital
Jordan,
signs.
Vitals?
step over here. I
Yes,
just
heart
wanna
rate
ask
is
you some questions
119.
about
so
medication.
nothing.
Heart
You
rate
ever had a
119?
surgery or anything like that that we should
she
know about?
Pulse
Yeah,
ox,
yeah, other
93%.
surgeries.
O2,
And,
93%.
Blood
That was
pressure is
important, but,
133 over
I was
77.
smoking about a month ago.
Blood pressure
Okay.
133
and,
over
I
77.
wear a patch.
So we have some medications
Okay.
that Jordan's taking.
And
It's the
are
nicotine
you
patch
able to breathe
patch.
okay? Or?
She's
and
her
2 baby
oxygen level's
aspirin
dropping.
every day.
Okay. And
In the morning.
Aspirin
yeah.
every day in the
Let's go ahead and
morning.
place just
Okay.
like a nasal cannula and give some
allergies
oxygen.
that Jordan
Like 2
has to
liters?
2
take?
liters would be great.
Susan, I'm going to go ahead and put
Jordan,
oxygen on her.
Kind of
Okay,
around your
oxygen.
nose to give you some more
She's
oxygen.
allergic to sulfa.
Okay, thanks. Yeah, I
and
can't breathe
iodine.
so
Yeah.
good. I don't know what's
Yeah.
happening.
So we
Have you
a
ever had
sulfa
any
and
sort of issues like
iodine
this
allergy.
before?
You don't look
I
it,
mean,
Jordan.
you know, I'm an
Sulfa and
ex-smoker,
iodine
so I
allergies.
have sometimes,
All right.
but
Okay. Yeah, that makes
I
sense.
don't
And
really
she
know where this is
smoked
going.
this morning, I
come
think.
on, it was
Oh,
one.
did
I
she?
had one. It was
I'm
not a
going to
big
go ahead and
deal.
place this right into your...
Okay.
Are you
we should
feeling, other than the
probably
shortness
take
of breath, okay?
How many liters, Deborah?
Okay.
My
2
chest
liters.
feels kind of tight, I guess.
Yeah.
Nasal
Chest is
cannula.
feeling kind of tight?
Yeah, just it started just now. I just
Deborah,
Okay, let me
Yes.
go ahead and take a
can
listen.
you go ahead and take the patch off
Oh,
as
sure.
well?
Okay.
Jordan, I'm going to go ahead and remove this.
Okay.
Yeah. Did,
Okay. Patches off.
A little bit of a
Patch
cigarette this
removed.
morning.
And my chest is feeling really tight. I don't know what's going on, but it kind of hurts.
Sarah, I'm going to go ahead and raise the oxygen up. She's
Think of
still
in
pretty
terms of-
low.
Okay, perfect.
So I'm taking it to 5 liters.
5 liters.
Oh, my chest. It feels.
Heart rate is 162.
Oh, it feels like someone's crushing my heart.
You're feeling some crushing pain
Yeah,
in the
yeah.
heart?
It feels like someone's standing on it.
Okay, so, okay, yeah, perfect. So maybe this could be something like angina. Maybe we want to get
Oh, it
like more-
hurts.
Everybody,
Morphine might be
the
good.
heart rate is at 160 right now.
Okay.
Oh, wow.
So Jordan, we're going to give you some pain
I'm going to
medication.
administer
Oh, it
morphine.
hurts.
Okay.
Oh,
And
it feels
actually, I'm
like
going to go ahead and give a
skeleton is
shock.
sitting on me.
Okay.
What do you mean a shock?
So because her heart rate's at 160, it's really high. And so if we can give a little bit of a shock, maybe we can reboot that heart to where it's supposed to be.
Oh,
I didn't.
oh, it
I
hurts.
thought you only did that to people that were like unconscious, though, right?
Well, we're not going to
Is
give
that-
we're going to give just a little bit of a shock so that we can, again, at the sustained level.
I agree with Michelle's concern. I'm concerned that we haven't taken into account all the possible factors here. I feel a little uncomfortable about shocking the patient without further diagnostics. Does everybody feel that that's safe for the patient?
Yeah, I'm sort of with Drew. I don't feel like we know enough yet.
Yeah, I'm a little bit uncomfortable as well.
Okay.
Oh,
Let's-
it hurts.
Let's go ahead and administer the morphine.
I'm gonna go ahead and give them morphine.
I'm going to call a huddle so we can kind of come up with the next
Morphine
plan.
is in.
Okay.
Morphine given.
So Jordan, we just gave you some morphine, so hopefully that's going to help with the pain, okay? Michelle, if you want to discuss with us, we're going to just see where we can go from here.
Sure.
Okay. So patient is a 55-year-old female who came in today for complaints of left shoulder pain. because she fell 2 days ago. Upon arrival, everything was normal, then started complaining of shortness of breath, so we gave a nasal cannula from 2 liters now up to 5 liters. Now she's experiencing some chest pain and tightness, so we gave morphine. What else is going on?
Patient Jordan has been taking baby aspirin every morning, as she did this morning. Is also on the nicotine patch, which we removed because she did smoke a cigarette this morning. Her medication allergies are sulfa drugs and iodine.
Okay.
Okay. Heart rate is 163. SpO2 is 93. Blood pressure is 133/77. We started with 2 liters of oxygen and we bumped that to 5 liters of oxygen. And we ordered a shoulder x-ray, but they haven't made it up here yet.
Okay, perfect.
And I administered a standard dose of morphine, and I also removed that nicotine patch.
Okay, perfect. What about our team? Deborah, how are you feeling?
I'm a little bit overwhelmed, to be honest.
Yeah.
I wanted to ask for assistance, but Susan, you seem just really tired. Are you okay?
No, not really. I mean, I probably should have mentioned it earlier, but I did an overnight shift last night and just came straight here and I'm exhausted. I'm really sorry. I could probably just take over maybe some phone calls or something.
Sure, that would be great.
Okay, I probably just shouldn't be involved with the patient care
Okay.
I
directly.
can help with the phone as well.
Okay,
Perfect.
good.
All right, good. No problem. What about our environment? Are we ready to proceed?
Well, when I was looking in the cart for the morphine, we don't have any nitro, so in case we
Okay.
want to administer that, we'd have to order it.
Good catch. That's a really good catch. What do we think is going on?
Well, maybe we could draw troponins and send that in and then order a 12-lead EKG.
Perfect.
See how the heart's doing.
Yeah, that sounds like a really good idea.
I'd be happy to go ahead and do the blood draws,
Okay.
and then let's make sure we get the nitro.
Okay. Perfect.
Nitro is what they gave you last time, right, sweetie?
I think, yeah, they sprayed something under my tongue.
I
Okay.
can call for the nitro.
Okay.
And also I'll call for an attending. Is
Okay.
that okay?
Yeah.
Yeah, perfect. Do you want to
Okay.
call for the troponin?
Yeah, I'll call for the
pickup?
troponin and the 12-lead.
And 12-lead, perfect. Okay, so Drew's going to call for an attending, and to the
Nitroglycerin.
nitro.
Mhm.
You're going to go ahead and call for
The trope and the 12-lead.
Okay, perfect.
And I'm on the blood draws.
Excellent, sounds good. And I'm going to go ahead and monitor the patient.
Okay.
So Jordan, with that pain medication, are you feeling any better?
Hi there.
Yeah,
This
that
is Drew
doesn't
calling
hurt
from
as
room
much,
A
but
with patient Jordan
really
Evans. We'd like to get
tired.
an attending in here.
Okay, that would be a common side effect of
Okay, thank you.
morphine. I mean, that would be to be expected. Is the pain kind of, it's going away though?
Yeah, the pain is going away some.
Hi,
Okay.
Wow,
forward
this
to
is,
please.
wasn't this bad last time. This is new.
This feels
Little
like
pinch
we're-
here.
Okay.
So
I
yeah,
have
we're
a
just
patient
we're drawing
Jordan
some
Evans
blood.
in room
Yeah.
So
A
we're gonna
and
get some
chest pain,
labs.
like some
We're also gonna
sublingual
get some images of the
nitroglycerin
heart as
down
well,
heart,
just to
please.
see. We want to rule out anything like if it's
Yes.
angina or if it's worse than
50.
that.
Like what?
Yes,
I mean,
chest
we
pain.
want to
Thank
rule
you.
out anything
Bye-bye.
what we call like an MI, which would be like a heart attack.
Oh, wow.
Oh
So
my
I
God.
don't, we just have to rule out some of those
All right.
things. But
Labs
it's
are ready
good
for
thing-
pickup.
Okay.
It's a good thing that you're
Hi, can I have
here.
your lab, please?
Thank you, Deborah.
Yes.
So again, we're going to
Hi,
send those to the
Stephanie.
lab.
This is
and
Susan
get some
with
information
Jordan
there, and then
Evans
we're
in
also going to
room
get some of
A.
that
I
nitro.
need to order
The
a
nitroglycerin
that
helps
helps.
Stuff
for it.
under my
Okay.
tongue
Great.
helps.
All right,
Perfect.
thank you
So
very
we're
much.
going
It's
to see
ready.
if
Thanks.
that really, maybe helps the situation and see how serious this is as well.
Okay.
You
Yeah,
said
but
Hi, I
imaging?
need
What does
to
that mean, like an
order
X-ray?
a
Well, we're still going to get an X-ray of the
12-lead.
shoulder.
Yes, a 12-lead, yeah.
Since you're
For
here,
room
but that's
A,
kind of secondary.
Jordan Evans.
We're also going to do
Great.
what we call a 12
All right, thank you very much. 5 minutes.
Okay, so right now she's getting her heart monitored, and so we want to just get a little bit more in depth with that.
Okay. And I ordered the 12-lead and the
Come on
troponin. The-
Okay.
Perfect. Thank you so much, Susan.
Hi, I am Dr. Pierce, the attending on this floor. Can you tell me what's going on?
Yes. So this is Jordan Evans.
Hi, Jordan. I'm Dr. Pierce.
And this is Michelle, her wife.
Michelle.
So Jordan's a 55-year-old female who came in today from shoulder pain.
Okay.
So she fell on her left shoulder about 2 days ago. Upon arrival, she's been having shortness of breath, so we gave her some oxygen.
Okay.
She's also been having some pain in her chest. She does have a past history of angina, so that's something we're a little bit worried about. So we ordered a 12-lead EKG and a troponin.
Perfect, okay.
Anything else?
Nitroglycerin was ordered.
Right. And I administered morphine and removed a nicotine patch.
Okay,
Yeah,
okay. What else do I need to know?
I think that's probably
I think that's it.
that's it.
Okay,
You're gonna
great.
be okay, Jordan.
Thank you very much. I'll take it from here.
Okay, perfect. Thank you.
Everything's gonna be all
Okay,
right.
Jordan.
All right.
The team is about to enter their debrief where they'll consider their performance and discuss how things went. Let's see how they do.
All right. So this is the debrief. How do you guys think that went?
Very well.
Yeah,
I think
pretty
that went
good.
really well, yeah.
Really well.
I agree. What went well?
We did a lot of check-backs or call-outs and
Call and check backs?
Yeah, exactly.
Yeah.
Using each other's names a lot.
Deborah was really nice and loud, which I really appreciated. And at one point, Drew, when we were doing a call-out check back, Drew came back over to me because he was talking to Michelle and gave me some information like allergies and meds that she was on.
Awesome.
Yeah, and I heard a lot of like response from the team. so
Yeah.
that was
Yeah.
Yeah.
I agree. You often close the loop on the communication, which was great.
Yeah.
There was one opportunity that I saw that was missed. Do you guys know what that was?
No.
So, Deborah, I think you initially called that the heart rate was 160.
Mhm.
Oh, wow, I didn't even hear
I
that.
didn't hear that.
I don't
Really?
think you called that out.
I did
right?
call that. I called that 160.
You called it out before, it sounds like.
I did, yeah.
I didn't hear that.
Were you calling back to her?
No. I just saw that. I
Uh-huh.
was concerned.
Wow, sorry we didn't hear it.
So, yeah, that's all right. This is the learning experience, but we do ask that people take responsibility for that, because if you're the initiator, you need to get the closed loop. If you don't, then it's just hanging and dangling there, and we know how important it was to notice that it was a 160.
So I should have just continued to call out till I got a response.
Exactly.
Well, that was good situational monitoring or awareness then, because if you called it out on your own,
Yeah.
Mhm.
that
Right.
was
Yeah.
important.
Definitely.
So that's good.
Yeah, good job.
And you noticing that the oxygen was
Mhm.
low.
Well, I thought overall our situational awareness was really good.
Yeah,
Yeah.
it
Well, mine
seemed
wasn't as-
seamless. It was like
Yeah,
we
mine
shared
was-
responsibilities and jobs. And
Yeah, mine wasn't as good. Sorry guys, I sort of dropped the ball on that a little bit.
That's what you told us, and so we could change our roles and
Yeah,
take
but
that
it would have been
on.
better if I'd done it here in the debrief, or in the brief before.
Yeah,
So we had that.
but it was nice to be self-aware. So
Yeah, I mean, I kind of noticed it during the brief, so I probably should have maybe mentioned it at that time.
And I should have just brought it up, but I thought I could muscle through it. I didn't want to leave you guys in a lurch and not show up or something.
I appreciated your honesty in that we shifted responsibilities and you sort of recused yourself from the.
Yeah, it wouldn't have been safe for me to be hands-on.
that was good to know.
So it's a good role flexibility.
Yeah, yeah,
Yes.
exactly.
Excellent. I agree. We really monitored everybody really well. There was great situational monitoring, but also role flexibility, as you said.
Yeah.
Anything else you want to talk about?
Well, and you called that huddle. That was great.
Huddle was
Yeah.
so helpful.
Yeah.
Good use of STEP.
I mean,
Yeah.
because it's hard to
You
know
rocked it.
exactly what you want to even talk about in a huddle, because it was a little chaotic at that point. So to go back to the step and know the plan,
Yeah.
that was really helpful, because then we kind of got all the information and then we could go forward. So it was nice, because I didn't necessarily know what to say.
No, it was good because we
Before.
all got to put in our
Yeah.
input
Yeah.
of what we'd observed or what
Yeah.
we'd done.
That was great.
And that was kind of gave us a direction.
Definitely.
Yes. And you
Yeah.
summarized, and we moved on from there. And what led to that, the cuss, when we
Yeah,
were going
we
to
did that.
defibrillate, but then I was concerned, and then we joined forces and spoke our minds. You calling the huddle was great after that.
Yeah.
It was
Is there
good. It
anything
was
you think you could have improved in the huddle?
including the patient and family member.
No,
Yeah.
we really didn't talk to Jordan
Oh,
very
okay,
much.
yeah,
did we,
that
at
would be good.
point?
Yeah.
I mean,
we
you were
should've.
there, but we didn't ask, and we didn't also explain the plan. Like, I was explaining to you afterwards, but it would have been good for you to agree to the plan
Yeah. and
before we
Right.
just started doing
And for
it.
Jordan too.
For
yeah.
Jordan, yeah, we really need to talk to the patient.
Yeah.
Yeah.
We talked to her other times, but just not right then.
Yeah, that would have been a good thing to do.
Yeah.
It was nice, though, that you included us by centering, and you did actually say you guys are going to be part of the huddle, so it's not like I felt excluded, but I agree that you could have asked us some more questions possibly. But great job. I'm really impressed. And thank you for supporting me with the defibrillator, because that was truly scary for me. And
Okay.
to have you back me up right away.
Yeah. Well, I'm glad you spoke up too.
Yeah, exactly. So that was nice. And I would just want to say that helped build trust. You know, as a
Yeah.
family member, I really felt like I could trust you guys to hear what I was saying. And every patient and family member wants to know that and feel that.
Yeah, it
thank
really felt
you.
like you were more advocating for the patient. Like, I didn't feel like
Yeah.
confronted or anything
good.
like that. So
Good.
it was nice to see that because it was about your concern, and I just
Right.
wasn't hearing it as well as
Yeah.
I should have been. So.
I felt we had pretty much equal voices, especially in that huddle. We each had an equal voice that we shared that felt trust.
Which
in
was
the
so
whole-
nice, yeah, in a situation like this to have everybody on the same level. Yeah.
Thanks for having my back when I was
No, no, no.
not having my best day.
Totally, yeah.
And I thought we did a pretty good job with the S bar.
Yeah.
Yeah.
Did we get all of
we
it?
Missed we missed the recommendation.
We did?
Yeah.
I mean, we did nitro, but I guess
Oh yeah, we should have done like maybe, I don't know, like cath lab
Yeah.
or
you're right.
ortho
Like a little bit further
consult.
on what
the
we would
shoulder
be.
injury too. I
Yeah.
don't know, ortho or whatever.
Yeah.
Okay,
That's true.
so
Yeah.
Almost.
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 I mean,
that
yeah.
close.
Right.
But great job, and that's what this is about. It's a learning experience, and
a lot.
I think you did an excellent job. So you should definitely take this experience into your clinical experiences. And continue building great teams as you did. I think there was immediate and swift trust, and you guys proved that over and over again for all of you.
It was really nice to brief beforehand so we knew, when we were going
So
in what we were
helpful.
doing.
Yeah.
Yeah, that was really nice.
A good brief.
Good. Yay us.
Yes,
Yes.
thank you. Well, thank you. You
Thanks,
guys have a
Michelle.
great day.
Thank you.
Thank
very
you.
much.
Thank you so
That was
much.
fun.
guys.
Yeah.
It was good
Awesome.
working with you.
Cool. Good job.